Kia ora, Iri. Lovely to come and visit you today. So how are you?
I'm good, thanks.
Amazing. So I know that sex is probably the last thing on your mind at the moment, but today I would like to discuss a very important topic with you, and that's contraception. Would that be all right with you?
Yes, it's okay.
Amazing. So the reason we discuss contraception is because we recommend to wait at least 18 months between giving birth and getting pregnant again. This gives your body time to fully recover before your next pregnancy.
So, what is the risk of getting pregnant if I'm not using a birth control?
Okay, so lactational amenorrhea or delayed menstruation often occurs if you are less than 6 months postpartum, fully breastfeeding, and your periods haven't returned yet. So, in the first 6 months, if you are fully breastfeeding, the chance of getting pregnant is quite low. If you are not breastfeeding, ovulation can occur within the first few weeks of childbirth. A lot of women think that if they are breastfeeding that they won't get pregnant, but this is not always the case. So the only way to be 100% safe is to use a form of contraception. Using birth control method in the weeks after your baby in the postpartum period helps to avoid an unintended pregnancy and lets you plan your family.
Oh, that's good to know.
Now, I understand that contraception is not for everyone, and what I'm discussing is just your options. You do not have to take any, especially if you have any religious or cultural beliefs that oppose taking contraception. Okay, Iri, so have you been on any contraceptives prior to pregnancy?
Yes, I was on the combined pill.
Okay, so postnatally, the combined contraceptive pill is contraindicated as it contains estrogen and it can affect your milk supply. So we do not recommend taking this when you're breastfeeding. So if you have any left over, I would make sure to throw them away.
Are there any alternatives?
So there is a pill called the progesterone only pill, which unlike the combined pill, it has no effect on breastfeeding or the baby. In terms of side effects for the progesterone only pill, it may cause irregular bleeding, and additionally, they must be taken at the exact time every day or else they will not be effective. I know that life with a newborn baby can be very hectic and your body clock can be all over the place, which can make taking a daily pill very challenging. So we do also offer longer acting forms of contraception, so you don't have to worry about this and taking the pill every day.
I'm showing the van. Actually, I was quite interested in the Jadelle. What is it?
The Jadelle, also known as the implant, is one of the longer acting contraceptions we offer. The implant consists of 2 little rods that we inject into your arm. They are about the same size as a matchstick and release a hormone called progesterone. They work well for many people as they are very effective, and less than 1 in 100 people on the implant get pregnant each year. They last up to 5 years, so you don't need to worry about taking the pill every day. You can also get one placed as soon as baby is born.
So, how will it stop me getting pregnant if it is in my arm?
So the implant releases that hormone called progesterone, which will stop your body from releasing an egg each month. It also thickens the mucus in your cervix so sperms cannot enter into the egg.
And how do you put it in my arm? Will it be a surgery?
The procedure is quite simple and only takes a few minutes to put in. Generally, you will come into a contraceptive clinic and a trained nurse or doctor will perform the procedure. First, they will give you an injection with local anesthesia to numb the area in your arm so you won't feel a thing. And they will then make a tiny incision, and a small device is used to place the implant under the skin. This may leave behind a tiny scar each time the implant is inserted or removed. The practitioner will place a band-aid over the incision, and once the procedure is finished, it is important to keep the area dry for up to 2 days to help the incision heal and to reduce the chance of infection. Your arm may feel a bit sore and bruised after the procedure, but just take it easy and it should heal over the next week or so.
Will it affect my periods at all?
You may notice a change in your bleeding. Some people will not bleed at all on the implant, while others will continue to have regular periods. Occasionally, people may find that they are bleeding more frequently and for a prolonged amount of time compared to before. Just know that if this does happen to you, there is treatment available to help. If you do feel worried about any redness, swelling where the implant was inserted, or if your periods are bothering you, please reach out, call the clinic, and arrange a follow-up appointment.
Okay, and will that affect my breast milk?
Research has shown that the implant has no effect on your breast milk or breastfeeding, and there is also no effect on your baby. So it is completely safe to have while breastfeeding, and this is outlined in the District Health Board guidelines.
So what are the main advantages and disadvantages of the contraception implant?
So the main advantages are that it's long acting, so once it's inserted, it will be effective for several years. It's easy to use, no pills to take, and you don't need to do anything to it. It's more than 99% effective, and it's safe to use while breastfeeding. In terms of the disadvantages, you may notice a change in your periods, which I previously discussed. Another disadvantage is that when the implant is put in, you may feel sore and you need to keep the area clean and dry because of the risk of infection. Another disadvantage is that it does need to be inserted or removed by a doctor or nurse, so you usually need an appointment, which may take some time to get put in or taken out. And additionally, the implant will not protect you against STIs, so condoms are your best option.
Okay, and how do I make an appointment for the implant?
Okay, so I have this resource for you, which has all the contraceptive clinics. We have 3 clinics to choose from, and you can just pick the one that's closest to you, give them a call, and they will arrange an appointment for you. Okay. In the meantime, Eddie, would you like a prescription for some condoms?
Yes, please.
Amazing. So I'll send you an e-referral for that. But in the meantime, I just have some pamphlets for you to read over. This one has all the different contraceptive options, so you can see the risks, the side effects, how it affects breastfeeding. So that one's really good. And I also have this one specifically about the contraceptive implant, which has all the information as well, risks, changes you might notice, and that one that I showed you before about the clinics. So you can have a read over those. And before we finish up today, do you have any questions or concerns you'd like to ask me?
No, I think I'm good. Thank you.
Amazing. But always feel free to give me a call if anything comes to mind. I'm always on the other side of the phone.
Will do. Thank you.